This is part 4 of my What's It Like to Be a Medical Assistant. Everything up to now has been practice. This part is where it stops being about practice. The externship is the moment you walk into a real clinic with real patients under a real supervisor and you put everything you learned to work. It's the scariest part, but it's also the best part because it's where you stop being someone studying medical assistant and start becoming someone who does it, right? So one quick thing in case you're new, I'm Darius, I run Career Bond. We're a career acceleration platform. This is my way of helping people understand if career training is right for them. So what we're going over in this 4-part series is what it's like to be a medical assistant. If this is your jam, then you know it's right for you. If this is not your jam, let's help you pick something else, okay? Part 1 was the clinical skills. Part 2 was the knowledge. Part 3 was the office side. Today in part 4, it all comes together and it's how it becomes real. So here's the map. We're gonna cover 3 topics: career development, learning to present what you can do, the externship, which is 160 hours in a real clinic, and then 3, putting it all together, what it actually takes to cross the line and become a certified medical assistant. If you choose to go to medical assistant school, this is how it ends. Ready? Let's go. Topic 1, career development. Before you ever set foot in a clinic, a good medical assistant program will teach you how to present what you can do. And this is the part people skip and then wonder why they stall. It's its own course at better schools. You'll learn to talk about your skills like someone who's actually done the work before, because it's not enough to just be trained. You have to be trained and then present yourself. You'll learn resume and interview technique, goal setting, how to carry yourself, because you're in an office environment. Here's the thing most people miss. The confidence in that room comes from one place. It's knowing your skills are real, and by the time you reach this component of a good medical assistant course, it'll be real and you'll know it, and the whole program is worth doing for that reason. Topic 2, the externship. This is the 160-hour externship. It's 4 weeks. It's in a real clinic. It's under a supervisor who's actually doing the work next to you. The first days, you're probably going to be nervous. You're going to be watched. And that's exciting, but it's exactly right, to be nervous. Real patients, real staff, real pace, and 100 small things going on at once that a classroom couldn't really teach you. You'll learn the floor. You'll learn where things are, how this office runs, how fast real medicine actually moves. It moves fast. You'll make small mistakes, you will, but you'll learn how to fix them, right? Every mistake is a learning opportunity, and that's what makes you better. So here's what I want you to hear. Everybody is nervous on day 1. Everybody. The ones who make it aren't the ones who weren't scared. They're the ones who showed up regardless of being scared and did it anyway. That's the whole secret. And there's a moment in every externship where it turns, where you stop being scared and the staff that you're working next to stops treating you like a student and starts treating you like one of them. Someone hands you something and trusts you with a patient. A patient thanks you and means it. You move through the day without being told what's next, and then it hits you. You belong there. That's the day the whole program pays off. Not graduation, not the certificate, but the day a real medical team counted on you and you delivered. So before we go on, a quick word. If you watched all 4 episodes on what it's like to become a medical assistant, you're not a tire kicker at this point. You're someone who's seriously considering this. So here's the real question for you. Is this the door for you, or is another healthcare path a better fit? The only way to find out is to talk to a career advisor or to go through the curriculum yourself, right? But let's take action. So please use the link below, book a call with a career advisor, and let's see if this is actually a fit for you. Don't let this knowledge fade into nothing. Okay, now we're back. Topic 3, crossing the line from student to practitioner. Topic 3 is all about finishing. Here's what done actually looks like, because it's not a participation trophy. You have to earn it. To finish a good medical assistant program, right, at a real school on site, you have to have at least 80% minimum attendance. You have to show up. You'll be graded the whole way. Tests, quizzes, labs, competencies, and the externship hours that have to be completed to graduate. When you get a diploma, that means the course is complete and the requirements have been satisfied, and you're ready to sit for a certification exam and go out there and hold yourself as a certified medical assistant. When you cross that line, you'll know you've achieved something, and so will everyone else, that you didn't get handed something, that you earned it. So let me bring the whole series home right? Because becoming a medical assistant, it's actually one of the best ways into healthcare. And let's recap. You started out maybe knowing very little, maybe flinching at a needle, not sure if you were even smart enough or tough enough for any of this. But by the end, you could draw blood, run an ECG, take vitals, hold a sterile field. In part 2, you learn and understand the body, the medications, the patients, the emergencies, what to do in the first 60 seconds of an emergency. In part 3, you could run the money, the privacy rules, and the front office that holds the whole clinic together. And in part 4, you took all of this into a real clinic and a real team counted on you. See how it all comes together? That's the whole journey. And here's the return on investment that I've said since part 1. The point was never the title, medical assistant, EKG tech, phlebotomy tech. It doesn't matter to me, right? The point is that you're now in allied healthcare. It's one of the easiest doors to get into, to learn a real skill set with skills that stack, and the need for trained people only grows. I care that you pick a path that gives you stable employment, a certification you can count on, and skills that stack. So if medical assistant is it for you, awesome. Use the link, book a call with the career advisor, and let's get you on your way. If you think a different discipline in healthcare is right for you, we have those too, right? Choice is yours, but make a choice. Take action. If this spoke to you, then this is probably your sign to become a certified medical assistant. If it didn't speak to you, keep looking, but just don't keep looking for life, right? Find a path that works. The people who finish what they start are a different breed. Finishing is a characteristic that carries a person through a program and out the other side as a person that can be counted on, a person that could be trusted, a person that could earn for themselves and their loved ones. I've seen this thousands of times, so the only question left is whether you want to go out and find it for yourself. And I'm rooting for you. So let's do this together. I'm Darius, and I hope you found this helpful.